This movie is about breast health and chest tissue health. It's for men and women who want to work over the musculature in their upper chest and in their breasts and under the armpits and in the intercostal muscles between the rib cage. And it feels good. It only takes a few minutes, and let's try it. I like to start by finding the collarbones. Right underneath there's a little indentation here, rubbing on both sides. If it's sore, it needs a little bit more rubbing. It feels really good. Taking nice deep breaths. And then I move out a little bit to the edge of the rib that I can feel. And then I move down one rib, down one rib. You'll find some ribs are really sore. Some spaces are really sore. Just work on them. And then we'll go around the bottom of the rib too when we leave. So I take my fingers this way and gently, be sure you're not clawing yourself with your nails. You want to start from the inside and move out. Just moving the tissue over the bones, back and forth. Feels really good. If it's sore, be gentle, but work the area. It feels really good. You want to be sure, especially for women, when we wear bras, the whole tissue of the chest is held in place for a long period of time. Bring your fists, soft fists, bring your knuckles, go up and down over the rib cage, all the way as high into the armpit as you can get, moving forward. Nice deep breath. You can even pull toward the center of the chest, right over the breast tissue. You can wear a bra or not wear a bra. This feels good all the way over the tissue to the sternum, all the way down into the lower rib cage. If you're ticklish, it means the tissue is tense. It means you're a little stiff there, so you might need a little bit more work. Take a nice deep breath. Get the other side. Pushing toward the center of the chest, right over the breast tissue. It feels really good. As far out as you can reach, in between the ribs, around the bottom of the rib cage. Follow the base of the rib cage up toward the xiphoid process. If it's sore, respect that soreness, but work it a little bit. It feels really good. Be sure to get the other side underneath the rib cage too. And then shake your hands out, rub them together just to energize them a little bit, and then go from the center sternum underneath the breast tissue. Follow the rib cage along to the outside. If it's sore, work it. Move the tissue. It feels really good. Why are we sore under there? Because most of us have been wearing tight clothes or bras that hold this area in place, and it never gets moved. It's held in place. Multiply that by 30 or 40 or 60 or 70 years. Tissue is not made to be held in place and not moved. Feels really good. And then again, we're on either side of the sternum. We're working straight up. Shake your hands out again. And then at where the rib cage comes together, the xiphoid process, the base of the sternum, dig in just a little bit. Move your fingers down about an inch and hold. Move your fingers down about an inch and hold. Move your fingers down about an inch and hold. It feels really good. All the way down to your belly button. And then move out an inch and come back up. Go ahead and rub your belly just a little bit all the way up into the chest. Hands on the shoulders, on the trapezius, and then pull forward. In the dip just above the clavicles, pull down. Really great after a long day, especially if you sit at a desk most of the day. And then curl the fingers inside the clavicle. Make a little dent there by bringing your shoulders up. Put your fingers in that indentation and work the muscles ever so gently. And then go underneath the clavicle. Again, we're working out. Start at the little indentation just below the clavicle. You can feel it between the ribs there. And that's it. Shake your hands out, rub them together, and thank yourself for helping you feel better.